Hello everyone, hope you all are doing good. So today I'll be discussing about the part 2 of cognitive drill therapy. So Dr. Jain introduces two layers. Okay, he identified the layers of irrational fear. That is, the client tell you that I have fear of height, I have fear of water, I have fear of a crowd, I have fear of public speaking. Okay, so all these will be client tell you, right? So after that we have to identify the layers. So he divided it into two layers, top layer and the bottom layer. So in the top layer, what will be included? Like the object of fear. Okay, and the top layer is the conscious layer. So it also you can call it surface layer. So we studied conscious mind, subconscious mind. So okay, so top layer is the conscious and bottom layer is the subconscious mind. So what is in the conscious mind? That is object of fear. Client will directly tell you that I have fear of this object, lizard, I have fear of crowd, I have fear of lift. Okay, so these things will client directly tell you, so that all these are in the conscious mind of the client. Okay, then after that we have to the client will tell you sometime, and sometimes we have to ask that what happens when you expose to that object. So that is body and mind reaction. So sometimes client have shortness of breath, sweating, increase in heart rate, okay, shaking of hands, shivering, okay, and repetitive eye blinking, okay, abnormal body movement. Okay, so all this we have to identify what are the body mind reaction happen after the exposure to the object of fear. Okay, then after that we have to ask, or the client may say about the safety behavior, that what you do to avoid those consequences, those body mind reaction. What does you do that you become comfortable and you become normal? So those are the safety behavior. Okay, so in case of the contamination, okay, in case of OCD, if client is having contamination or fear, so the client with the safety behavior is the repetitive washing of hands, right? Or in case of the height phobia, the client will avoid the area, those area. Client will avoid public speaking, client will avoid going to outside, right? So all those are the safety behavior. So we have to note it down, all these 3 points under the top layer. Okay, then come to the bottom layer, that is in the subconscious mind. So what are in the subconscious mind, we have to identify. So now we'll talking about the bottom layer. Okay, what is in the subconscious mind of a person who comes to you? Fear of height, fear of lizard, fear of crowd, fear of public speaking. Okay, so there is a when you speak to the client after a conversation, when you expose, when you explore actually their thoughts, okay, how it comes, when is the first time the client faces that. Okay, so when you go back to the history, when after a time of conversation you come to know their cognition, feared cognition. Okay, so there is some thought in back mind, so that thought is associated with that object. Okay, so if a person are saying you that I have fear of public speaking, I can't speak in the public, so there must be reason, right? So why the person is not able to speak in the public. So there is the fear of embarrassment must be there, fear of humiliation must be there. There must be incident happen when the client tried to speak in the public, or when client was trying to put their point of view and he was discouraged, he was humiliated. Okay, so such kind of event must happen in the past. Okay, so you have to explore that. So here you will identify the fear thinking, that is the deep thinking associated with the object of fear. Okay, in this surface you are finding that client is not speaking in the public, client is very introvert, right? So what is the reason behind, what is the deep thought behind that, as a result of which this is happening? The client is not able to speak in the public. So the feared cognition can be fear of humiliation, fear of embarrassment. Okay, so in case of the contamination, I avoid dirts, I'm not able to contact with any kind of dirts, I avoid that. So there is the in deep inside, so there is the fear of contamination, right? Fear of getting dirt. So so you have to identify that thinking, deep thinking. Okay, after that you have to identify that what are the consequences can happen if client exposed to that object. Okay, so what are the consequences will happen, what will happen to the client? Okay, not the body mind reaction, in the client mind. So you have to ask the client and that what is going to happen. Okay, if client is exposed after humiliation, if you speak in the public and you are not able to speak, so what will happen? If they humiliate, then what will happen to you? So you have to try to gain the insight of the client. Okay, and you will notice that all the sentences will be in the future tense. Okay, so first is the cognition, thinking or cognition, that fear thinking or cognition, and second is the consequences, what will happen in the client mind, not the body mind reaction consequences. Okay, please note it down that. And third is that the all sentences client will be speaking in the future. Okay, so this is the structure of the bottom layer thoughts. Now is the final step. So here we'll be formulating the sentences. Okay, so in the very first session we have talked about the tenses, right? A, B, C. We have talked about past tense, present tense, and the future tense, right? So C was to denote that the future tense, right? So we'll be change their thought process from C center to A center. Okay, so here we are we'll be working on the subconscious mind. So that's why we have identified that what are in their subconscious mind. So in their I gave example of fear of humiliation, and fear object was public speaking, avoiding public speaking. So we'll work upon the if there is less anxiety, then we can work on the directly on the subconscious thought that I'll be humiliated. So it will be like I'm being humiliating. Okay, I was humiliated. Okay, so like that we have to change the sentence. Okay, so like in the lift, he was avoiding lift, right? There was or avoiding the crowd space. Okay, so what we find out in the bottom layer, that is in the cognition, fear of getting suffocation, right? So I'll be in suffocation. So I was in suffocation, I am in suffocation. Okay, so when the client tell that, so in first their the graph of anxiety will be the increase. Okay, so what you can do, so you can like you ask the client to speak initially. If fear level is very high, you can ask the client to repeat the sentence 3 times, then the breathing. Okay, you can dilute their anxiety by, it can be any kind, you can help the client in deep breathing. Okay, or you can talk about any other thing. Okay, so that will be done. And also you have to, when you the client will speak all those sentences, so you will notice the body mind reaction. Okay, bodily reaction. So you have to formulate the intervention to minimize those body mind reaction. Okay, so there may be in case of the shortness of breath, so you have to try to relax the client by taking long deep breath. Okay, if client is having shaking their hands, so you can use the techniques from the JPMR. Okay, contraction and relaxation, contraction and relaxation. Okay, so those technique you can use in the body mind to reduce the minimize the body mind reaction. So you have to look after that, what is body mind reaction happen, and once you stop them, once they are not repeating those sentences, so those body mind reaction will automatically reduce. So you have to increase the anxiety, then dilute it, increase the anxiety, then dilute it. Okay, so like that if you do it for 30 minutes. Okay, and you have to educate the client before starting this process. Okay, why we are doing this, what is going to happen when they will speak those sentences. So when client know about the process, so if client is having anxiety also, then client will be motivated, right? And client will try by themselves to make it, right? So you have to, before starting this process, so you have to educate the client. Okay, and so first will be we'll increase this anxiety by creating those sentences, then we'll try to dilute. Okay, for the dilution you can use anything according to the situation and according to the his or her bodily reaction. Okay, so these are all about the cognitive drill therapy, in short about cognitive drill therapy. Okay, and thank you and stay connected. And if you want to get certification on this therapy, so you can connect with me. Thank you.